I am not a doctor, but what I discovered about aspirin deeply surprised me. For years, I thought it was just that small pill you take for a headache or a fever, something so common that it almost goes unnoticed in any home's medicine cabinet. However, when I researched more deeply, I understood that behind that simple tablet, there is a silent secret that can make a big difference in our health after 60 years of age. Aspirin has existed for more than 100 years. It was developed at the end of the 19th century, inspired by the ancestral use of willow bark, and it soon became one of the most widely used medications in the entire world. Millions of people have used it to relieve muscle pain, lower fever, or reduce inflammation. But over time, scientists began to discover that its action went far beyond being a simple painkiller. What is interesting is that, despite all these findings, the use of aspirin in older adults is still a controversial topic. Some doctors recommend it preventively, while others warn about possible risks. And in the middle of this confusion, many people do not know whether they should take it or not, nor what the real benefits could be for them. That is why I wanted to prepare this video, to talk to you without beating around the bush about what science has discovered about aspirin and how it can impact our life after 60. Today, I will tell you 10 ways in which this little pill can help your heart, your memory, your joints, and even help prevent certain serious health problems. We will also talk about the risks you must not ignore and about how to make informed decisions together with your doctor. My goal is not to replace professional advice, but to offer you clear and practical information so that you can have a better conversation with your doctor and decide whether this silent ally could have a place in your daily routine. Before we begin, I would love to get to know you a little better. Tell me in the comments how many years old you are and from which country you are watching me. That way, I will know whom I am accompanying on this learning journey. Now, let us discover together why aspirin could be much more powerful than you imagine. The story of aspirin begins long before modern medicine existed. Since ancient times, different cultures used willow bark to ease pain and lower fever. The ancient Egyptians, the Greeks, and even the Romans prepared infusions of white willow bark to relieve ailments. They did not know why it worked, only that it did, and they considered it one of those mysterious gifts of nature. It was only in the 19th century that scientists began to seriously study this property. They discovered that the bark contained a substance called salicin, which was responsible for its calming effect. However, pure salicin had annoying side effects, such as severe stomach irritation, so the challenge was to find a way to preserve its benefits without harming the patient. In the year 1897, a young German chemist named Felix Hoffmann, who worked for the company Bayer, managed to synthesize a modified version of salicin, acetyl salicylic acid. With this modification, stomach irritation was reduced and the calming and anti-inflammatory effects were maintained. That is how aspirin was born, which was launched on the market shortly afterward and quickly became a success in Europe and then in the rest of the world. During the 20th century, aspirin became a basic element in almost every home. It was inexpensive, easy to obtain, and effective for relieving headaches, reducing fever, and treating muscle discomfort. It was also used for rheumatic diseases and in flu recovery. For many older people, taking an aspirin was almost a domestic ritual, something as normal as drinking a glass of water. What few knew then was that aspirin had a side effect that would change medicine forever: its ability to reduce the formation of blood clots. This finding, which was confirmed with studies decades later, opened a new era in the prevention of heart attacks and strokes. The active ingredient in aspirin, acetyl salicylic acid, works by inhibiting enzymes called cyclooxygenases, which are responsible for producing substances that cause pain, fever, and inflammation. Put simply, aspirin turns off the body's alarm signal that generates those symptoms. And at the same time, it prevents platelets from clumping together so easily, which helps blood flow without forming dangerous clots. That is why, although its history began as a natural remedy against pain, over time aspirin became a key tool in preventive medicine. Today, it is still one of the most studied, most prescribed, and most recommended medications on the planet. But its true power does not lie only in relieving pain. In the next sections, we are going to discover how this small tablet can improve the health of the heart and the brain, and even help prevent serious diseases. And we will also talk about the risks you should know in order to use it safely. One of the greatest discoveries about aspirin was its ability to thin the blood. Simply put, aspirin works by preventing platelets, those tiny cells responsible for forming clots, from clumping together too quickly. Clots are necessary when we have an external wound, but if they form inside an artery, they can block the flow of blood to the heart or brain, causing a heart attack or a stroke. By reducing the platelets' ability to stick to one another, aspirin helps blood flow more easily and reduces the risk of a dangerous blockage forming. This property forever changed the way doctors treated people with a history of heart disease. I remember the case of Mr. Ernest, a 72-year-old man who suffered a mild heart attack. After he recovered, his cardiologist recommended a low daily dose of aspirin. Months later, during a routine checkup, they discovered that he had had a small episode of angina that could have ended in something serious. Thanks to aspirin and other changes in his lifestyle, the episode did not progress further. Mr. Ernest usually says that that pill gave him time to watch his grandchildren grow up. Stories like Ernest's are repeated all over the world. Many people who have had a first heart attack or a stroke take aspirin to prevent a second event. This is called secondary prevention. It is not about avoiding it from happening for the first time, but about reducing the risk of it happening again. Primary prevention, on the other hand, is when someone who has never had a cardiovascular event takes aspirin to try to prevent it from occurring. This is where experts often debate, since in people without a history of events, the benefit can be smaller and the risk of bleeding can outweigh the protection. Over the last few decades, large studies have been carried out that have confirmed the role of aspirin in secondary prevention. International research has shown that its regular use in low doses can significantly reduce the likelihood of a second heart attack or stroke. These findings led health organizations around the world to include aspirin in treatment guidelines for high-risk patients. What is important to understand is that not all older adults should start taking aspirin on their own. Although it can be a powerful tool to protect the heart and the brain, it can also increase the risk of internal bleeding if used without supervision. That is why it is always recommended to consult a doctor before starting this type of treatment. Aspirin is not a magic pill, but it is a great ally when used correctly. In the next part, we will see how its effect on circulation not only protects the heart, but can also benefit the brain and memory, something that worries many people as they age. One of the most fascinating discoveries about aspirin is its possible relationship with brain health. Just as it helps blood flow more easily through the heart's arteries, it also improves circulation in the small blood vessels that feed the brain. Good cerebral circulation is key to keeping the mind alert, thinking clear, and memory active, especially after 60 years of age. Imagine for a moment Mrs. Mercy, a 78-year-old woman who used to forget her keys and repeat the same stories several times a day. Her doctor recommended a low daily dose of aspirin, not only for her heart, but also to promote blood flow in the brain. Over the months, Mercy noticed that her lapses became less frequent. It was not a miraculous or immediate change, but it was enough for her to feel that she was regaining part of her independence and confidence. Several studies have investigated the relationship between the regular use of aspirin and a lower risk of developing certain types of dementia, including Alzheimer's disease. The results are not conclusive, but some trials have shown that people who took aspirin for cardiovascular reasons had a lower probability of cognitive decline over the years. The explanation is simple. By keeping the blood more fluid, the risk of small clots that could silently damage brain tissue is reduced. There's also research suggesting that aspirin could have a mild anti-inflammatory effect in the brain, which might help slow processes that accelerate neuronal aging. Chronic inflammation is one of the factors that most affect brain health in old age, so any help in this area is valuable. However, it is important to say this clearly. Aspirin is not a cure for dementia, and it does not guarantee that you will never develop it. It is just one more piece within a healthy lifestyle, which must include good nutrition, regular exercise, mental stimulation, and control of other diseases such as high blood pressure and diabetes. Precautions are also necessary. If a person has had brain hemorrhages in the past, has active ulcers, or has coagulation problems, the use of aspirin may increase the risk of dangerous bleeding. In these cases, the decision should be made only under medical supervision. The message is clear. When used correctly and at the right dose, aspirin can be an ally not only for the heart but also for keeping the brain in good condition for longer. And keeping the brain young is just as important as keeping the body moving. In the next part, we will talk about how this medication can also help relieve joint pain and inflammation, something that worries almost everyone who has passed the age of 60. One of the most common problems after the age of 60 is joint pain. The knees, the hips, the hands. Little by little, they start to hurt when getting up, walking, or trying to open a jar. For many people, this pain is due to inflammation caused by the natural wear of cartilage, something we know as osteoarthritis. This is where aspirin once again proves its value. Thanks to its anti-inflammatory capacity, it can help reduce swelling and stiffness in the joints, which makes it possible to regain some mobility and decrease pain. Although it is not a specific medication for osteoarthritis, many people have found relief by taking it moderately and under medical indication. Aspirin works in a similar way to other anti-inflammatory painkillers, such as ibuprofen or naproxen, but with the advantage that in low doses it can provide cardiovascular benefits at the same time. However, it is important to remember that in high doses it can cause stomach discomfort and increase the risk of bleeding, so it should never be overused. Mr. Rogers' case comes to mind, a 75-year-old man who had stopped going out for walks because the pain in his knees was unbearable. His doctor suggested a plan that included gentle exercises, physical therapy, and a controlled daily dose of aspirin. Over time, Roger not only reduced his pain, but also regained the confidence to return to his morning walk in the park. He himself says that what he appreciates most is being able to bend down to tie his shoes without feeling as if his back is breaking with pain. Aspirin is not a magic solution and does not replace other treatments, but it can be part of a comprehensive approach to managing chronic pain in older adults. Combined with good nutrition, low-impact exercise, and regular checkups, it can make a big difference in quality of life. Besides its role in heart and joint health, aspirin has attracted the attention of researchers for its possible ability to reduce the risk of certain types of cancer, especially colon cancer. This effect was discovered by chance when it was observed that people who regularly took aspirin for cardiovascular problems seemed to develop less colorectal cancer than those who did not take it. Long-term studies carried out in different countries have supported this observation. Research that followed thousands of people for more than 1 decade found that those who took low-dose aspirin consistently had a reduced risk of developing advanced polyps and colon cancer. It is believed that this effect is due to aspirin's ability to reduce chronic inflammation in the lining of the intestine, which could slow the formation of abnormal cells that give rise to tumors. However, these benefits seem to appear after several years of regular use and are not the same for everyone. That is why experts insist that aspirin should not be taken solely as a preventive measure against cancer without medical supervision, but rather as part of a comprehensive health plan. It is also essential to consider the possible risks, especially in people with a history of gastric ulcers, chronic gastritis, or digestive bleeding. For them, the prolonged use of aspirin could be more harmful than beneficial. In these cases, doctors often recommend stomach protectors or different alternatives. Research in this field continues, and every year new studies are published that analyze not only colon cancer, but also other types of cancer such as esophageal and stomach cancer. Although the results are promising, the recommendation is still to individualize treatment. What can be a great protection for some may become an unnecessary risk for others. Aspirin does not only act inside the body, it can also have visible benefits on the skin. Thanks to its anti-inflammatory action and its ability to reduce the production of certain substances that cause redness and swelling, it has been used in some dermatological treatments for older adults. Inflammation is a key factor in many skin problems, from rosacea to certain types of late-onset acne, so aspirin's calming effect can make a difference. Many people use homemade aspirin masks to reduce skin redness, although it is always advisable to do this under the guidance of a dermatologist. The principle is simple. When applied topically, it helps deflate the pores, reduces the burning sensation, and improves the appearance of affected areas. I remember the story of Clara, a 70-year-old woman who began to experience acne breakouts on her chin after menopause. This affected her self-esteem and made her feel uncomfortable going out. Her dermatologist recommended a cream that contained derivatives of acetyl salicylic acid. Within a few weeks, Clara noticed that the lesions decreased and the redness became less visible. She once again felt confident in front of the mirror. In addition to its benefits for the skin, aspirin's antioxidant action could help reduce certain aging processes related to oxidative stress. Although this is not its main use, some research suggests that it may help protect cells against long-term damage. Of course, not everyone should use aspirin topically. Some very sensitive skin types can become irritated, and it is not recommended to apply tablets directly without diluting them. The important thing is to know that its potential goes beyond headaches, and that when used properly, it can improve overall skin health and help keep it calmer and more even. Risks and side effects they do not tell you about. Although aspirin has many benefits, it can also present significant risks if it is not used correctly. One of the best-known side effects is the increased risk of gastrointestinal bleeding. Aspirin irritates the lining of the stomach and intestine and, in some people, can cause gastritis, ulcers, or internal bleeding. Another key point is its interactions with other medications. If a person already takes anticoagulants to prevent clots or medications for high blood pressure, aspirin can enhance their effects and increase the risk of bleeding. Even some natural supplements such as garlic, ginger, or ginkgo biloba can have an additional anticoagulant effect, which could be dangerous if everything is combined without supervision. Mr. Julius's story is a good reminder of the importance of caution. He had heard that aspirin was good for the heart and began taking one every day without telling his doctor. After a few months, he began to feel dizzy and extremely weak. A medical checkup revealed that he had anemia due to slow bleeding in the stomach. It was necessary to stop the aspirin and treat the hemorrhage before his condition worsened. That is why, before starting to take aspirin regularly, it is essential to talk to a doctor. Only a professional can assess whether the benefits outweigh the risks in each particular case. It is not about being afraid, but about using it wisely and in an informed way. Aspirin is a great ally, but like any powerful tool, it must be used with respect. In the next part, we will talk about who are the people who can really benefit from its use and who should avoid it so that you can make a clearer decision. Who should take it and who should not. Not all older adults should take aspirin preventively, and not all should avoid it. The secret lies in knowing which group you are in. Doctors usually recommend it for people who have had a heart attack, a stroke, or who have a very high risk of suffering one. It can also be advised for people with stable angina, coronary stent placement, or certain circulation problems in the legs. In these cases, the benefit of preventing another cardiovascular event usually far outweighs the risk of bleeding. There are risk factors that make it more likely that the doctor will suggest low-dose aspirin, controlled high blood pressure, high cholesterol, type 2 diabetes, or a family history of early heart attacks. If you have several of these conditions, it is possible that your doctor will consider that aspirin can help protect your heart and brain. On the other hand, there are situations in which aspirin is contraindicated or must be used with extreme caution. People who have active ulcers, recent gastrointestinal bleeding, or known allergies to acetyl salicylic acid should not take it. Special care is also needed for those who suffer from severe kidney problems, bleeding disorders, or who take powerful anticoagulants, since the risk of hemorrhage may be too high. One important detail is the dose. Not all aspirin tablets are the same, and the common tablet used for pain is not the same as the low dose indicated for prevention. Adjusting the amount and frequency is something that should only be done with professional guidance. Many times, the preventive dose is so small that it is surprising, but that small amount is enough to obtain the protective effect without increasing the bleeding risk too much. The conclusion is clear. Aspirin can save lives when used in the right person, and it can cause serious problems when used in the wrong person. That is why the medical consultation is so important. It is not about making decisions based on what works for a neighbor or a friend, but on what is appropriate for your medical history and your current health conditions. Ways to safely incorporate it into your routine. If you and your doctor have decided that aspirin is right for you, the next step is to learn how to take it safely. Most of the time, a low daily dose is recommended, known as baby aspirin or preventive aspirin, which is usually around 75 to 100 milligrams. This amount is enough to maintain the anticoagulant effect without causing as much damage to the stomach as a full dose. The time of day you take it can also make a difference. Many specialists advise taking it at night, after dinner, because that is when the body produces more platelets, and this way a more uniform effect is achieved. In addition, taking it with food reduces the risk of gastric irritation. A good habit is to take it with a glass of water and make sure you do not take it on a completely empty stomach. Some people also use stomach protectors if they have a history of gastritis or recurring discomfort. This detail should be discussed with the doctor, since not all protectors are compatible with all medications. Another recommendation is not to stop taking it suddenly without consulting first. Abruptly stopping aspirin in people with cardiovascular risk can cause a rebound effect that increases the likelihood of clots. If you ever need to interrupt it for surgery or a dental procedure, it is important to do so under professional supervision and to resume treatment when indicated. It is also a good idea to keep a record of the medications you take to avoid dangerous interactions. If you use omega-3 supplements, garlic capsules, or high-dose vitamin E, mention it to your doctor, because all of them have an effect on coagulation and can enhance aspirin's effect too much. Incorporating aspirin into your routine is not just about swallowing a pill, but about integrating it into a healthy life plan. Balanced diet, moderate physical activity, regular checkups, and control of blood pressure and blood sugar. Only then can its preventive power truly be harnessed. Although aspirin is a great ally when it is indicated, it is not the only option to improve circulation and reduce the risk of clots. Nature offers us foods that have a mild anticoagulant effect and that can complement or, in some cases, replace the use of medications when it is not possible to take them. Garlic is one of the best known. For centuries, it has been credited with properties for improving blood circulation. Consumed regularly, it helps keep the blood more fluid and can contribute to reducing blood pressure. Some people even take one raw clove of garlic every morning as part of their health routine. Turmeric is another of these allies. This yellow spice, widely used in Indian cuisine, contains curcumin, a compound with a powerful anti-inflammatory effect that can also help prevent clot formation. Adding it to soups, rice dishes, or smoothies is a simple way to take advantage of its benefits. Omega-3 fatty acids, found in fish such as salmon, tuna, and sardines, as well as in flax seeds and chia seeds, also have a natural blood-thinning effect. In addition, they help reduce triglyceride levels and protect the heart. If you take aspirin and want to include these foods in your diet, it is advisable to do so in moderation and to mention it to your doctor. Although their effect is natural, combining them excessively with anticoagulant medications could increase the risk of bleeding too much. The ideal is to achieve a balance, adding healthy foods that enhance circulation without falling into excess. Lastly, it is important to remember that no food or supplement completely replaces aspirin's effect when it is medically necessary. They are complementary tools within a healthy lifestyle, which should include regular exercise, good hydration, stress control, and periodic medical checkups. Living longer and better with informed decisions. Today we have taken a very complete journey through aspirin. We saw how it was born from the bark of a tree and became one of the most important medications in history. We discovered how it helps prevent heart attacks and strokes, how it can benefit memory and brain circulation, and how it reduces inflammation in the joints and improves mobility. We also explored its potential to reduce the risk of colon cancer and its positive effects on the skin. We did not ignore its less friendly side, the risks of bleeding, interactions with other medications, and the importance of using it only when it is truly necessary. We also learned who can take it safely and who should avoid it, as well as the correct way to incorporate it into the daily routine and the natural foods that can support its effect. The main message is that aspirin can be a great ally if it is used properly. It is not a miracle pill or a universal remedy, but it can make a difference in the lives of millions of older adults when used wisely and under medical supervision. Always remember to consult a professional before starting any treatment. Health is not about copying what works for others, but about finding what is safe and effective for you. In the end, it is not just about living more years, but about living them with quality, fullness, and well-being. Now I would love to hear from you. Tell me in the comments if you have ever taken aspirin regularly, whether your doctor has recommended it to you, and from which country and at what age you are watching me. Your experience can help others in this community make better decisions.